So you are welcome back to the afternoon lecture. My name is Abraham Akuzi. I'm here to take you through the pharmacodynamics of antipsychotics. So antipsychotics basically, when administered, targets dopamine receptors, particularly dopamine 2 receptors. However, antipsychotics bind to more than one receptors. For example, clozapine, for instance, block alpha 1 and alpha 2 adrenergic receptors, histamine 1 receptors, muscarinic receptors, and glutaminergic receptors. This afternoon, I want us to seize a moment and then talk about the dopamine receptors in the brain. So, scientists have postulated or suggested some four main dopaminergic pathways in the brain. So, all these pathways have dopamine receptors in them. Dopamine has a role to play in all these four pathways. So, let's start with the neuroswitcher pathway. They've said that the neuroswitcher pathway involves in motor control. The neuroswitcher pathway involves in motor control. So when dopamine level is diminished or D2 receptors are blocked in the neuroswitcher pathway, it causes a group of symptoms we call extra pyramidal side effects of the antipsychotics. Examples of such symptoms, we have dystonia, which is involuntary muscle contraction. You have something like Parkinson's symptoms. You see them like a shuffling gait, and then you have shuffling gait and muscle rigidity. And then tardive dyskinesia, lip smacking and then tongue blowing. It's characterized by lip smacking and tongue blowing. We have akathisia, which is restlessness, someone who cannot stand still or sit still. Yes, restlessness. When G2 receptors are blocked in the neuroswitcher pathway, we see all those symptoms. Let's move to the mesolimbic pathway of dopamine. Mesolimbic pathway of dopamine involves in reward and motivation. Reward and motivation. Yes. This particular pathway, when dopamine level is too high, or in the case of schizophrenia, there is always an overactivation of the mesolimbic pathway, and that normally contributes to a higher dopaminergic activities in the pathway, and that leads to the positive symptoms of schizophrenia. That is always associated with the mesolimbic pathway. So, when you administer antipsychotics, what the antipsychotic does in this pathway is that it goes to block the dopamine 2 receptors in the mesolimbic pathway, thereby reducing dopamine activities in the pathway, which helps to alleviate positive symptoms that are associated with the pathway. Yes. So let's move to the mesocortical pathway of dopamine. We say it influences learning and then memory. It influences learning and memory. Dopamine is needed in this particular pathway in a minimal amounts. But in the case of schizophrenia, clients with that condition, schizophrenia, normally dopamine level is usually low in the mesocortical pathway, and that actually accounts for the negative symptoms and the cognitive impairments of the brain. Yes. So the negative symptoms we have alogia, apollution, anhedonia, and then social withdrawal. So this implies that administering antipsychotics to a schizophrenic patient will go a long way to manage the positive symptoms in the mesolimbic pathway. But then, is that antipsychotics effectiveness in managing the negative symptoms and cognitive impairments which is associated with the mesocortical pathway is limited? It's limited. Let's take notes of that. Then let's move straight to the last pathway, which is the tibial-infundibular pathway. It influences hormone release. Hormone release. The tibial-infundibular pathway is a dopaminergic pathway that connects the hypothalamus to the pituitary glands. It connects the hypothalamus to the pituitary glands. Dopamine's main purpose, dopamine main purpose in this pathway, or its job in this pathway, is to block or to inhibit prolactin release from the anterior pituitary gland. Prolactin release from the anterior pituitary gland. So, blockage of D2 receptors in the tubuloinfundibular pathway goes to compromise the job of dopamine in the pathway, which is to inhibit the release of prolactin from anterior pituitary gland and anterior pituitary glands. So by so doing, when you block dopamine D2 receptors in this pathway, what you are simply doing is that you are opening ways for prolactin to be released from the anterior pituitary glands. Anterior pituitary gland, which means that there will definitely be hyperprolactinemia. Hyperprolactinemia, which is basically high levels of prolactin in the system. So prolactin will be excessively high. So we term it as hyperprolactinemia. And then this can cause galacturia, excessive milk production. Gynecomastia is abnormal breast growth. And then we have irregular menstrual cycle, infertility, and then lower libido. So I want to plead with you that you, after receiving this lecture this afternoon, just do me a favor by liking the video, by subscribing to our channel, and if possible, comment at the comment section so that we can help ourselves. Thank you very much.